We are going to talk about the cardiovascular system today, which is chapter 13. So we'll start with a little bit of the anatomy. Main organ is going to be the heart. So located in the mediastinum, which is that kind of subdivision of the thoracic cavity, the apex or the, let me get my pointer here, this little protrusion right here. So here's the apex. That is going to lie on the diaphragm, and the heart is going to be the shape and size of a closed fist. Now this is approximate because I know there's a lot of variety in the size of our fists. So mostly midline, but about 2/3 of it is going to sit slightly left. Because of the location, specifically between the sternum and the vertebrae, we can perform CPR, or cardiopulmonary resuscitation, which is where we are doing a rhythmic compression, and this can maintain blood flow during cardiac arrest. So here's a little diagram. Again, the apex is that kind of blunt protrusion. So midline would be about right here. So you can see how it sits a little slightly to the left. Broken up into 4 different chambers, right and left, and upper and lower. So the upper chambers are going to be the atria, or the receiving chambers, and then the lower chambers are going to be the ventricles, or the discharging chambers. So we'll have a right and a left atrium and a right and a left ventricle. One thing to note with this is that the heart is hollow, so it's not just a solid mass of muscle. If we look at this picture, we can see how there are openings. So this would be the atrium up top, and then the ventricles down below. So they are open. Atria are going to be smaller than the ventricles, and their walls are thinner and less muscular. And then there's also a septum, which is going to separate the chambers. So we have an interarterial septum and an interventricular septum. The walls of the heart chambers are going to be composed of cardiac muscle called myocardium. And then the endocardium is going to be the smooth lining of the heart chambers. So if we're looking at this picture, the endocardium is going to be the lining of the heart chambers. The pericardium is a 2-layered fibrous sac with a lubricated space between the 2 layers. So the inner layer is the visceral pericardium. It can also be referred to as the epicardium. And then the outer layer is the parietal pericardium. This is similar, of course, to the terminology used in the pleural cavity and also in the abdominal cavity. So that visceral is going to be the inner layer, kind of surrounding the heart itself, and then the outer layer is the parietal, which is going to cover the mediastinum. So here you can see the visceral is real close on the heart, and then here is going to be the parietal, so on the outside, and then the pericardial space is in between. So the heart is going to pump in a rhythmic contraction. So the contraction is going to be referred to as systole, and the relaxation is diastole or diastole. This contraction is what is going to pump the blood through the heart, or excuse me, through the body. So with that, it is important that the direction of blood flow is directed and controlled. So we have valves that keep the blood flowing through the heart and prevent backflow. So we're going to have 2 atrioventricular valves and 2 semilunar valves. So the atrioventricular are going to sit between the atrium and the ventricle, and we have a left and a right. So the left AV is also called the bicuspid or the mitral valve, and the right AV is going to be the tricuspid valve. The pulmonary semilunar valve is going to go into the pulmonary artery, and then the aortic semilunar valve is going to separate out the aorta. So here you can see the two semilunar valves. So the aortic semilunar is going to sit in the aorta, the pulmonary is in the pulmonary, and then we have our atrioventricular valves here. So the heart is going to pump and make this kind of lub-dub sound. So let's see. If you guys can hear that. So the lub, or that first sound, is going to be caused by vibration and closure of the AV valves during contraction of the ventricle. And then the dub, or that second sound, is going to be caused by the closure of the semilunar valves when the ventricles contract. So the first sound is the closure of the AV valves, and then the second is the closure of the semilunar valves. So the heart is going to act as two separate pumps. So the right atrium and ventricle perform different functions from the left atrium and ventricle. So it is going to kind of take in blood from different areas of the body and push it out to separate areas. So venous blood is going to enter into the right atrium first from the superior and inferior vena cava. It's then going to pass from the right atrium through the tricuspid valve into the right ventricle, where it's pushed out through the pulmonary artery. So then it's going to circulate to the lungs, come back through the pulmonary vein into the left atrium, where it passes through the mitral valve or the bicuspid valve, and then it's going to flow into the left ventricle, and then it's going to pump through the aorta, passing through that aortic semilunar valve to then begin its systemic circulation, so circulating throughout the rest of the body. So here's just a little picture to show that. So again, superior vena cava, inferior vena cava, they're going to meet up, and the blood is going to go through the right atrium, through the tricuspid valve, into the right ventricle, through the pulmonary semilunar valve, through the pulmonary artery to the lungs, and then up to the pulmonary vein, into the left atrium, through the mitral or bicuspid valve, into the left ventricle, and then through the aortic semilunar valve to the aorta, going out to the rest of the body. This is just another diagram depicting that, which can also be found in your book. So one thing to note is that the heart actually has its own blood supply, which is referred to as coronary circulation. So this is from the right and left coronary arteries, which branch off of the aorta. So they are going to supply the blood, which contains oxygen and nutrients, to the heart itself. So if we look here, here's the aorta, and then here is the right coronary artery and then the left coronary artery. So this is what provides blood to the heart itself. It doesn't get blood or get the oxygen and nutrients from the blood that's inside of it. It has to come through its own circulation. If there is ever a blockage of blood flow through these coronary arteries, it's called a myocardial infarction, also known as an MI or a heart attack. And then angina pectoris is chest pain caused by inadequate oxygen to the heart. To correct this, we can do a coronary bypass surgery where we take veins from another part of the body and then it's used to bypass the blockages in those coronary arteries. So if this was the obstruction here, we would simply bypass that portion by connecting another vessel down below. So a cardiac cycle is one complete phase of the heartbeat. So a contraction phase and a relaxation phase. So systole is the contraction and then diastole is the relaxation. So this is a regular and rhythmic cardiac cycle. Typically there's about 72 beats per minute is kind of average for the heart. So this cycle is controlled by electrical activity. So the conduction system is what is going to coordinate these electrical signals, specifically the intercalated discs. And these lie in the muscle fibers and allow those electrical impulses to conduct throughout the entire wall of the heart chamber without stopping. So this is going to cause both atrial walls to contract at the same time, as an example. So we do have specialized structures that are going to generate and conduct these impulses. So the first is the sinoatrial node, or the SA node, also referred to as the pacemaker. And this is located in the wall of the right atrium near the opening of the superior vena cava. So this would be the SA node right here. Next, it's going to travel to the atrioventricular, or AV node, which is located in the right atrium along the lower part of the interatrial septum. So here you can see the AV node right here. Then it's going to travel to the AV bundle, or the bundle of His, which is located of the ventricle. So here is the start of that AV bundle. And then it's going to travel through the Purkinje fibers, which are located in the walls of the ventricles. So kind of innervates throughout. So if there is a heart block or a disturbance in these impulses, an artificial pacemaker can be implanted to help with those electrical impulses. So an electrocardiogram can be performed, which is a graphic recording of the heart's electrical activity. So the electrical impulses from the heart are picked up on the surface of the skin. So normally there's little stickers that are put on the outside of the body, and then you'll see a visible tracing on the electrocardiogram, or ECG, EKG as well is another term for it. So with the normal ECG, you're going to have 3 different waves. So the P wave is the depolarization of the atria. The QRS complex is the depolarization of the ventricles, and then the T wave is the repolarization of the ventricles. And if any of those areas are abnormal, then whoever's reading the EKG can determine where the issues of the heart may be located. So a little bit of terminology associated with the heart is cardiac output, which is going to be the volume of blood pumped by one ventricle per minute. So this is typically about 5 liters in a normal resting adult. And this can be determined by the heart rate and the stroke volume. So the heart rate refers to the number of heartbeats per minute, and stroke volume refers to the volume of blood ejected from the ventricles during each one of those beats. Different types of blood vessels that we'll find in the cardiovascular system are arteries, veins, and capillaries. So arteries are going to carry blood away from the heart and towards the capillaries. The veins are going to carry blood towards the heart and away from the capillaries. And then the capillaries connect those arteries and veins. So the structures found within the blood vessels are going to be the same names. So it's always going to have these three layers. However, there's going to be variances in these layers depending upon if we're talking about an artery or a vein. So the outermost layer is the tunica externa, which is going to be a thin layer of fibrous elastic connective tissue. The middle layer is the tunica media, and this is made up of smooth muscle, and you're going to see that it's thicker in arteries than it is in veins. And then the inner layer is the tunica intima, which is a single layer of squamous epithelial cells, lines the entire inner surface of the cardiovascular system. So the thing that you'll see here that's different is the tunica intima in the veins are going to contain valves to prevent the backflow of blood. So here's the tunica media. So you can see the difference in width between the artery and the vein, much thicker in the artery. And then in the tunica intima, you can see how there's these valves within the vein, but nothing in the artery. So the main functions of these arteries are going to distribute nutrients and gases. They also help kind of control the blood by moving it when it's under high pressure. The capillaries are going to serve as the exchange vessels for nutrients, wastes, and fluids, and then the veins are going to collect the blood for return to the heart. So this diagram just shows the different arteries found in the veins, or excuse me, the different arteries found in the body. And then there's a chart that goes along with it, and these are in your book as well. And then we have the veins and the chart for those too. So a couple of different routes of circulation. So there's three. Blood circulation is going to refer to the flow of blood through all the vessels. Systemic circulation is going to refer to the blood throughout the body. And then we have pulmonary circulation, which is going to refer to the flow of blood to and from the lungs. So blood circulation is made up of systemic and pulmonary circulation. So with systemic circulation, we're going to go from the left ventricle through the aortic semilunar valve into the aorta, and then through arteries, arterioles, capillaries, and this is throughout the body, venules, and then it'll meet up again at the vena cava and go into the right atrium. In pulmonary circulation, we're carrying blood to and from the lungs. So this is to gain oxygen and get rid of carbon dioxide. So this is going to go from the right ventricle through the pulmonary semilunar valve into the pulmonary artery to the lungs, and then through the pulmonary veins to the left atrium. So this just kind of shows the flow of the blood throughout both the systemic and pulmonary circulation. Another type of circulation that we'll talk about is hepatic portal circulation, and this refers to the blood route through the liver. So in this circulation, the veins from the spleen, stomach, pancreas, gallbladder, and intestines do not pour their blood directly into the inferior vena cava. It needs to go through kind of a filtration process before it continues on. So what they want is for nutrients, or what the body wants is for nutrients and waste to be deposited into the liver instead of circulating throughout the blood. So the veins from those organs are going to flow into the hepatic portal vein and then into the capillary bed of the liver, where the liver is going to detoxify the blood. And then once that occurs, the blood will go through the hepatic veins into the inferior vena cava, where it would then flow up to the heart. So these would be all the veins coming off of those organs. And you can see here's the hepatic portal vein. So it will go through the hepatic portal vein into the capillary beds of the liver, where it is detoxified, and then through the hepatic veins to the inferior vena cava. And then the last route of circulation that we'll talk about is fetal circulation. So this refers to circulation before birth while the fetus is inside of the mother. So there are some modifications required for the fetus to secure the oxygen and nutrients from the maternal blood. So what we'll see is the placenta, umbilical arteries and veins, the ductus venosus, the ductus arteriosus, and the foramen oval or ovale. So the ductus arteriosus is going to bypass the undeveloped lungs of the fetus. The foramen ovale is going to direct blood flow from the right atrium to the left atrium. And then the ductus venosus is going to bypass the immature liver. So when the baby is born and they take their first breath, the increased pressure is going to cause those bypasses to collapse. And then they'll heal and we'll have our normal anatomy. So this kind of shows those different structures. This diagram can be a little bit confusing when you're first looking at it, but keep in mind that this is the fetus. So this is referring to the anatomy of the fetus. So this would be inside of the uterus. And then we have the umbilical cord, which would come off of the fetus and then attach to the fetal side of the placenta. And then we have the maternal side of the placenta here. So just keep in mind that we can't see the maternal anatomy. This is strictly fetal anatomy that we're looking at. Here is the ductus venosus bypassing the liver, the foramen ovale going from the right and left atrium, and then the ductus arteriosus, which is bypassing the pulmonary circulation. So when we're talking about hemodynamics, it's referring to the way that the blood flows. So blood pressure is going to be one component of this, and this is the push or force of the blood inside the blood vessels. It's going to be the highest in the arteries and the lowest in the veins, which would make sense because we're pumping it really hard out of the heart and it's going into the arteries. And then as it circulates throughout the body or throughout the lungs, it's going to slowly lose that force. So here we can see that pressure pretty high in the aorta, and then it slowly goes down, down, down until it's the lowest in the vena cava. Some factors that could influence this are blood volume. So the more volume we have, the more pressure is going to be exerted on the vessel walls, and that is going to cause the flow to slow down a little bit and the blood pressure to raise. The strength of the heart contraction. So this is going to have an effect on that initial force that we're pushing the blood out. So it will affect the cardiac output. A stronger heartbeat is going to increase pressure while a weaker beat decreases it. And then our heart rate is also going to increase. An increased rate will increase the pressure. So if our heart is beating faster, it's pumping blood out at a higher rate. So increased pressure on those vessels. Blood viscosity, or the thickness of the blood, less than normal viscosity is going to decrease pressure, while more than normal is going to increase pressure. So if you think of the difference between water flowing down the side of a mountain, it's going to go really fast, not a lot of pressure, as opposed to lava, say, on the side of a mountain, really going to trickle slow, increased pressure throughout. And then we have the actual vessel's resistance to blood flow. So the vasomotor mechanism is going to refer to the vessel muscle contraction or relaxation. So this is that smooth muscle, the tunica media, that it's referring to. So if the smooth muscle is relaxed, we are going to have an increased diameter, which is going to allow more blood to flow through easier. If that smooth muscle is contracted, it's going to kind of clamp down on the vessel, and then the blood isn't going to be able to flow through as smoothly. There are fluctuations in arterial blood pressure. The normal blood pressure is going to fluctuate depending upon age, and it will vary quite a bit among individuals. So what they deem to be normal average is 120/80. Central venous blood pressure is going to be determined by evaluating the pressure within the right atrium. So the return of blood to the heart is going to depend on 5 mechanisms: a strongly beating heart, adequate arterial blood pressure, valves in the veins functioning properly, the pumping action of skeletal muscles as they contract, and then changing pressures in the chest cavity when breathing. So when it's talking about the pumping action of skeletal muscles, if we think about the gastrocnemius or the calf muscle, there's veins running through there. When we stand up on our tiptoes or when we're walking and we clench those calf muscles, what we're doing is kind of squeezing those vessels and pushing the blood through. So it's helping to bring the blood back to the heart. A pulse is defined as the alternate expansion and recoil of the blood vessel walls. These are used or can be used to determine the heart rate. So we have 9 major pulse points, which are named after the arteries over which they are felt. So we have 3 on each side of the head and neck, 3 points in the upper limbs, and then 3 points in the lower extremities. So we have the temporal, facial, carotid, brachial, radial, which is the most common, femoral, popliteal, posterior tibial, and then the dorsalis pedis. That is chapter 13. If you guys have any questions or want to visit more about any of these topics, just send me an email.